Hello, everyone. Welcome to my Ask Me Anything all about histamine overload, well, you guys probably know it as histamine intolerance. And I call it histamine overload. We can talk about what the differences are between the two today because they are significant. They are important for you to know, especially if you've been struggling with histamine intolerance issues, hives, dermatographia, any type of histamine style reaction that you're having from food, from your environment, all sorts of stuff. We're going to cover a ton of content today. And there is a chat. So if anybody, if you'd like to, please share what type of histamine issue that you're having in terms of histamine intolerance, whether it's just with your skin or you're having gut reactions as well to certain types of food, and where you're coming in from. If you haven't submitted questions ahead of time, because as you guys know, I love the ability to hold space for people who cannot necessarily make it when we do these things live. Please feel free to also put your questions into the chat now. That way I can either put them in because I did kind of put questions in a certain order just to try to help make sense of them, so that we're like at least talking about things in an order that makes sense. But also, if I'm talking about something and you have a clarifying question, please throw that into the chat as well, because it's really helpful. So, of course, as you guys know, if you're here, you probably follow my channel. If you do not, this is my YouTube channel. Make sure to join my community by hitting that subscribe button right next to my name, especially if you're on, for example, a desktop computer. You'll see my name underneath this window and a subscribe button. It'll also be there if you're on a mobile device as well. Please subscribe to my channel. That way, anytime we go live, and we've actually got two more of these Ask Me Anythings coming up. The next one will actually be tomorrow, a little bit different of a topic, but on psoriasis specifically. And then I just added another one today, which will be on candida overgrowth. So we'll dive into all fungally things on Wednesday, January 10th at 3:30 p.m. Eastern Time. So if you want to be in the know and you're not on my newsletter list, which by the way is really easy to rectify, I'll put those links below here if you want to get on the newsletter list to be able to ask questions ahead of time. But if you subscribe to my channel, you'll also get notified of when these get scheduled, and you'll be notified when we go live. All right, so I want to dive into this because I want to be mindful of everybody's time. But basically, histamine intolerance, I should say, is a really big problem. And for many people, they're not sure whether what they're struggling with is histamine intolerance or I will say a lot of people with eczema have a mistaken idea because of how much this is written about online. And we've got a lot of integrative practitioners who will tell you that if you have eczema, you have a histamine problem. That's actually not true, believe it or not. So most eczema, and especially the itch driven by eczema, is not histamine driven. And this has been proven through research that has been done at Johns Hopkins University with Dr. Sean Quatra. I've actually had him on the Healthy Skin Show. I interviewed him earlier this year. I'm happy to share a link to that episode so you can go back and look at that. But it wasn't just the interview that changed my mind. I had seen this clinically not make any sense, where people would take antihistamines and they weren't doing anything to impact the person's level of itchiness, specifically with eczema. So we'll get to a moment about dermatographia, chronic hives, urticaria, that kind of stuff. So I don't want you to think if you have eczema and you're here thinking like, wait, is Jen telling me that I don't belong here, that I actually don't have a histamine issue? Yes, it is possible to have histamine intolerance and eczema. However, if you've been assuming that you have histamine intolerance simply because you read that online and you're still of the mindset that eczema is due to a histamine problem and you're itchy because of histamine, there's a high likelihood that unless you have other factors involved that lead you to that conclusion, you cannot use your itchiness as the benchmark to know that you have histamine intolerance, because again, most itch is not histamine driven. So that's a really important clarifying point, because if you're trying to do, for example, a low histamine diet and it's not helping your eczema, it's not helping your itchiness, and it's not helping other symptoms, Well, then what are you doing? Just dieting harder with low histamine isn't going to help things. So we don't want to become over restrictive. And so that's a really important clarifying point up front. And the reason I'm saying this is because someone had asked this question. I was diagnosed with atopic dermatitis and told I have an elevated ANA, which is the anti-nuclear antibody test, which is run through blood. Do you know if it's associated with the release of histamine? So the ANA is actually a general marker for autoimmunity. It's not, it has nothing to do with histamine. And again, that's why I started off this about the clarification about eczema and histamine intolerance. So you can't go off having eczema and say, oh, I have histamine intolerance as a result of having eczema. That may not be true. There's a high likelihood that that's not true. It's a real small subset of folks with eczema who actually do have histamine intolerance at the same time. If you came up positive with the ANA marker, what you need to do is ask your doctor either to run other autoimmune panels looking for antibodies to other tissue. Like, for example, you would want to run a thyroid panel to look at the TPO or thyroid peroxidase antibody or the thyroglobulin antibody. You'd want to look for potentially other autoimmune conditions, and usually rheumatologists will run these things that'll look for Sjogren's, lupus, etc. So that's the route by which you want to go. I would not necessarily assume nor connect an ANA, an elevated ANA marker with, or a positive ANA marker with histamine intolerance. You really do have to have specific symptoms. And so the next question is, what are the symptoms of histamine intolerance? Well, it really kind of depends. Some people have issues with histamine intolerance where it will show up on their skin. And so the two conditions that I consider like a dead ringer, like absolutely you've got a histamine issue, are if you have urticaria or chronic hives and dermatographia. Those two for sure are signs of histamine overload, or we could say histamine intolerance. I do want to talk about, I apologize, I'm so used to saying histamine overload, and I recognize that most people are more familiar with histamine intolerance, which is a thing, but it's not nearly as big of a concern. I oftentimes find that we need to look deeper into why we're having these types of reactions. So if you're having something like dermatographia, hives, urticaria, whatever the diagnosis was in that arena, then you definitely have some level of a histamine intolerance. I would say absolutely histamine overload. Okay. Now, other symptoms can include things like becoming really reactive to foods, especially certain foods that are high in histamine. You can have different types of bowel issues. So some people will end up with diarrhea after they have certain foods. It can make your blood pressure drop, for example. That can be another common side effect. But a lot of times it's where you're constantly on antihistamines, and the antihistamines are really required in order to manage your symptoms. And sometimes 1, 2, 3 antihistamines may not be enough. So, fermented foods may be an issue. You may be a really like a sneezy type of person, very, very allergy prone. You're sort of like, especially as the seasons change, you feel like your symptoms get worse. There's all sorts of concerns. I would also add rosacea is also not necessarily a skin condition that means you have histamine intolerance. Now, if you look at the foods that commonly have an issue with histamine intolerance, then that can be a bigger concern with things. I just want to make sure, can you guys hear me? I just wanted to double check that you're able to actually hear me because I'm not seeing my microphone light up at all. And I just wanted to double check that that is actually, can you guys hear me at all? Yes. Okay. Thank you so much. I appreciate it. So rosacea is another condition where sometimes you can have histamine intolerance, and sometimes people will notice that the list of trigger foods can be can overlap with basically a low histamine diet, where those trigger foods also tend to be trigger foods for histamine issues. Does that actually mean that rosacea underlying it is a histamine problem? Not exactly. There's a very different physiologic and immunologic thing happening under the surface with rosacea versus like hives or dermatographia. So, is it possible to have some type of issue with rosacea and histamine intolerance? Yes, but it's not the rule. So those two things I think are extremely important. I'll also share here, I have a couple of links of episodes from the Healthy Skin Show that if you haven't checked them out, could be really helpful for you. I'll throw them into the chat. That way you'll be able to go open them up in another browser window and read them after the fact. I think it's really important to become educated on these topics because it's really easy to read blogs and to assume that what you're reading is your specific situation, right? There's so much nuance to this. And the problem that I have with this is if you decide without the kind of some level of guidance what you have is a histamine problem, and then you start cutting out foods and you end up on an extremely restrictive diet, because I'm not going to sugarcoat it. The low histamine diet is an extremely restrictive elimination diet. It's not meant for life. And so unfortunately, we have people that are using this diet endlessly and they're not getting better because they're thinking that the diet will heal them. And the diet's not meant to do that. The diet is a Band-Aid. It's meant to help reduce histamine levels in the meantime while you're supposed to work on the other root causes. That's why I talk about the concept of histamine overload, as opposed to just fixating on histamine intolerance. So an intolerance, just so you guys know, which this is important, an intolerance implies that you have a lack of an enzyme required to break something down. So the most common type of intolerance we're all familiar with is lactose intolerance, where we don't have enough of the lactase enzyme to break down lactose, the sugar that's found in all different sorts of milks. And so people experience all sorts of GI complaints if they can't break this sugar down. Well, the same goes for histamine intolerance. What it's specifically talking about is the enzyme diamine oxidase, or DAO, which is a gut-only enzyme that is meant to break histamine in the GI tract down. The problem here is that there are plenty of people who do not get a sufficient amount of relief from doing a low histamine diet. They also do not feel better from supplementing with DAO enzymes. And yes, they're very different enzymes, if you didn't know this, from digestive enzymes that are commonly sold on the market. You actually have to specifically buy DAO enzymes, which usually are derived from pork or pigs. There are some others that can be derived from like pea shoots and whatnot, but those are not easy to find. And I don't honestly know if they're as effective. I can't actually tell you that. Oh, I love the questions, Joe and Diana. So I'm getting to that about this. We can talk about bacteria, because when we think about histamine intolerance, this is the problem. It's all about what you consume, right? Everything is about what we eat, because that's all it is. DAO. It's an enzyme in the GI tract that we're assuming either isn't produced in a significant enough quantity or something's gone wrong with it in the way that it was produced. One could also potentially argue that maybe there's a lack of copper present within the GI tract, because that enzyme needs copper specifically in order to be active. It's a cofactor for it. But generally speaking, most people don't feel better from doing this. So then we have to ask ourselves what's going on. And for example, they can't get off of a low histamine diet. When they start to reintroduce higher histamine foods, they really struggle. So that's where, as I began to think about this clinically, I'm like, there's something else going on. And if you've had that experience, I would love for you to share that in the chat, because it is really, this is a hard situation to be in. It ruins your life for many people. There was one client that I worked with. She was actually in my Skin Rash Rebuild group program a couple of years ago, who had such severe dermatographia. And she was a young woman. I think she was like 25 or 26, that she could no longer wear any clothing that was at all tight, that would press in. So, think about your tank tops, your undergarments, waistbands, socks, even tight pants like yoga pants and such. She couldn't wear anything that was tight at all, because that, even the smallest amount of pressure, and we're not even talking about the food piece, just the pressure itself was enough to trigger this issue for her, where she would break out in this huge amounts of welts. She was incredibly itchy. She was really, really miserable, really struggled as well with food. That felt, I think, at the time when she joined that program, less of a concern for her. But histamine intolerance, and this kind of goes back to those signs. We can develop histamine issues from, well, you could find triggers essentially from different things that you don't get from other skin conditions can't necessarily relate to. So dermatographia, for anyone watching this who doesn't know, is where it's basically like derma, so skin, writing, graphia. So it's skin writing. So if I was to draw a line or something on my hand, a spiral, even with the tip of my nail or the end of a pen, I would welt up in that pattern. And so pressure can be a trigger, changes in temperature. So like cold versus hot. Sometimes people will notice if they go and exercise, that is enough to destabilize mast cells such that they start to degranulate. And even the smallest amount of getting warm and increased body temperature can cause a breakout of hives. Some people will find that even, for example, vibrations, touching certain things will cause issues. And some, they have no idea what the heck is going on. They'll just end up with hives randomly and can't seem to get rid of things, or welts will show up and they'll last for hours on end. So, these are pretty significant issues that are extremely frustrating for people, which I very much understand. As I shared, that poor client of mine was really, really, really upset because it had compromised her quality of life. It impaired her from being physically active. It prevented her from wearing a lot of common clothing that she felt comfortable in. And so, I really have a lot of I really feel for people going through this. So in terms of testing, right, to figure out what exactly is going on. So I got a couple of questions here. What tests should I ask my doctor for? I think I have histamine intolerance. Does allergy testing make sense for someone with histamine-like symptoms for unknown reasons? So the first thing I'm going to tell you is that, yes, generally speaking, if you're having histamine type reactions, I think it's worthwhile to get an allergy panel done. Unless it is cost prohibitive, I do think it's worthwhile. And it's not just getting a blood test. There may also be contact allergens in the environment that may also cause the issue. So that would be a combination of like skin prick, blood testing, whatever the allergist, and that's usually an allergist will do that. Now, is it uncommon to get those panels run and see nothing come back as an allergen? Yes. Yes. So you don't necessarily have hives or dermatographia or histamine intolerance because you're allergic to something. Is it possible that that's a factor? Yes. But is that actually, like, can you not have these issues and still have it? Yes. So I just want to give somebody, if you felt like your doctor told you, like, they're completely perplexed as to what's going on, they don't know what to tell you because your testing came back negative, it doesn't make sense. You must have an allergy to something. That's not necessarily true. Again, that's why I talk about histamine overload. So, histamine overload, and then I'll tell you guys a little bit more about testing. Histamine overload is basically, imagine you have a cup. I have a graphic on one of these episodes that I shared, and the links I shared in the chat, where it's a cup. And so the point of that was to show you that we have all of these exposures within our environment, our diet. We have other factors that may not have anything to do with food. It could be things like, you could have a drop in DAO, and I do have that on there. You could have cross-reactive pollen allergies. You could have those IgE allergies to pollen, dander, chemicals, all sorts of stuff in the environment. There could be genetic SNPs. There is an intracellular enzyme called HMNT that breaks histamine down intracellularly. So the cells within the body. So we're now outside of the GI tract, right? So if you think about the GI tract itself, that's where DAO is. HMNT is everywhere else. They do not coexist in the same places. Okay. So you could theoretically have a genetic SNP in HMNT that could be causing an issue. Now, however, the problem is that usually if this is something that the onset was later in life, it might not be a genetic SNP. Because if you were able to tolerate high histamine foods for most of your life and then this all of a sudden started, probably not that. Is it impossible that, it is an issue? No, you could, but it's not likely. Now, also high estrogen is a factor that can make your cup higher and closer to the brim. Mold exposure, mycotoxins can also do that, as can heavy metals. So I share this because you have to think about, what if you have a combination of things? These, if you do get to see the graphic, by the way, it is not in any particular order, so don't rate any of these by any type of importance based on where they are in the cup, higher or lower. And it could be that maybe you have a huge amount of for example, excess estrogen that you're unable to get out of your system due to issues with phase 3 detox. And you've got some gut microbiome issues, right? Unfriendly bugs. You struggle with histamine foods. So you still haven't eliminated some of those really higher histamine issues. You've got a drop in DAO for whatever reason. Maybe there's not enough copper in the system. And on top of it, you moved into a house that was super duper moldy. And now you've got, your cup is just overfull and you cannot compensate. That's the problem, is that we lose tolerance, right? I think because we use the word intolerance, which inherently implies that there's an enzyme issue, that it prevents us from seeing that the body's lost tolerance. And so we fail a lot of times to ask, well, why? Why does that happen? So in terms of testing, here's what I suggest. I mean, I have a lot of labs that I generally suggest people get, and I can't give out the whole list here. I can rattle off some things, but some of these are not, a lot of the labs that I suggest are general labs that your doctor can run. They're not necessarily specific to histamine problems. So the labs that are more histamine specific would be total serum IgE. And you could, like I said, allergy panels would be part of this as well. And in terms of like really looking for histamine issues, that's like, we're looking at stool testing at that point. We're looking at other things. I know that for a long time, people used to run like plasma histamine and tryptase, but those have actually been removed from the criteria that helps doctors diagnose specifically MCAS, or mast cell activation syndrome, as of the 2020 consensus. So I talked about that in a very recent episode of the Healthy Skin Show, where I interviewed Dr. Jill Carnahan, and we actually went over what that consensus is. So if anybody is interested in seeing that, I can easily pop that into the chat, because that is definitely a good episode. And we have the link up to the paper. I'll throw that in here. So that way you guys can find it, because MCAS is very different. MCAS is really serious. That is different. So histamine overload. So we have histamine intolerance, where it's specifically a dietary issue. Then we've got histamine overload, where really we're looking at the system globally and figuring out what's going on to drive such an excess of histamine that your body can no longer tolerate the level, can no longer break it down efficiently. And so you're left with this massive amount that you simply cannot break down appropriately. And now it seems like you're just reacting to everything. Whereas MCAS, or mast cell activation syndrome, is drastically different, where you are really, really extremely ill. And at this point in time, you do actually require the help of a physician, oftentimes may need medications to help stabilize mast cells. So they're kind of a different class of, I don't even know if they call them, I don't think they're even considered antihistamines. They're considered mast cell stabilizers, things like ketotifen or cromolyn sodium. Some of these things can even be compounded at certain pharmacies. But you may need higher level medications. So if you think that you have, so first of all, histamine intolerance is not a diagnosis. So that's part of the problem in that question of like, what should I ask my doctor for? That's not a diagnosis. It's not a diagnosis that is recognized by Western medicine, number one. Number two, this is really, I would say, where we have to look at some of these underlying drivers. And for the person who asked about that episode with Dr. Jill Carnahan on the mast cell activation syndrome, that's how what I just described is the difference between histamine intolerance, histamine overload, mast cell activation syndrome, and then you've really got mastocytosis all the way at the really, really extreme severe end of things, which is very, very rare. So that's why I would say once you hit mast cell activation syndrome, that's where you need to be working with an actual physician who has training, who has prescribing rights, and can get you the things that you need. It would definitely be somebody like a DO or an MD. Some states, naturopathic doctors have prescribing rights, but not in all states. So you just want to make sure that you're working with the right level of a provider, depending on what you have. We do a lot of work with histamine intolerance and histamine overload in my practice, because that's within my scope of practice. It's something that I can really, and I know just from clinical experience, that we can really make progress on. So I think those are a couple of good points to make. So let's go through some underlying questions, like discuss some possible triggers, right? We've already talked about the genetic SNP. I don't know. So here's the thing. I don't think that having inflammation. So first of all, inflammation is not a root cause. Inflammation is an actual process by which our immune system is activated. And so I think we have to be careful here in just going, well, this is an inflammatory process. That's great. That's not actually helpful at the end of the day. What we want to look for are things that drive up that histamine response. So I'll give you an example. Here's another example of a client. So this client did have eczema, and she thought, because she was super, super itchy, she had like pretty extensive eczema. My recollection was like somewhere around 65% of her body was covered in eczema. She'd had it for a really, really long time. And so as we were going through her case, I was like, something's not right. Like, your blood labs are funny. Something's really not right here. She thought she had maybe a histamine issue and had been on antihistamines for a really long time. And when I looked at her blood work, her total IgE had been high. And I was like, that's interesting. It's like historically been high for like 10 years. And she told me that, oh, by the way, I have a severe tree nut allergy. So when I've asked why that was high, the allergist told me it was because of the tree nut allergy. And I was like, okay, but you just had these labs like recently, and they told you that it's because of the allergy? And she said, yes. I said, "How long have you had known about the allergy?" She said, "Like 10 years. I haven't had nuts. We don't bring them in the house. I am like 100% abstain because of how severe the allergy is." And I'm like, "Well, then the total IgE wouldn't still be high. It still wouldn't be high. Like that doesn't make sense. It would come down because it is in response to a current exposure. That doesn't make sense." The other thing that I noticed was that her eosinophils. So I apologize. In the process of this, you guys were asking about testing. The other thing, and this is really easy to get, most of you get it annually, is on your complete blood cell count, you always want to make sure to get the differential. So a CBC with differential. And what that does is give you the white blood cell counts. And so one of the white blood cells are eosinophils. Now, this is not 100% of the time, but she also had elevated high levels of eosinophils. Okay. And I was like, something's not right here. I think maybe you have a gut problem. And she had constipation and all sorts of other things, but I was like, I think you got something lurking under the surface that's increasing your eosinophils and elevating that total IgE. A lot of times that, not all the time, but sometimes that can be a parasitic issue. So anyway, long story short, stool testing showed that she actually had Blastocystis hominis. Not everybody, by the way, please don't take that as, oh, I have hives, I must have Blastocystis hominis. You don't. Like some people may have that, some people may have a combo of things. I have no idea. I can't tell you. There's no like one thing. But she had that. Her doctor did not believe the stool test that she had ran a stool test locally through, I think, LabCorp or Quest. It came back high. And now she had to treat it. And by treating it, that level really dropped significantly. And her rashes didn't entirely improve because the blasto wasn't the only problem that she had, but she did see a sizable improvement in her digestion, her itch factor, her reactivity to things. And so that was really, really helpful. So that's one thing to consider, is that a lot of times we want to look for these big, like I understand about wanting to look for genetic SNPs, but there's not a whole lot that you can do all the time. Sometimes you have to look for underlying factors. You have to look for mold. You have to look for parasites. You have to look for bacteria that produce histamine. So bacteria that can produce histamine are things like Morganella. The Klebsiella species, not Klebsiella pneumoniae, can produce histamine as well. Those two are kind of the big ones that commonly get picked up on stool tests. There's a whole list of other bacteria, but literally organisms in your GI tract that you have swallowed, which is especially a factor if you don't have sufficient stomach acid, can cause an excess amount of histamine to fill that cup up, so that when you go and you eat your sauerkraut or you eat your strawberries or whatever that are higher in histamine, or your protein powder, your collagen, you can't tolerate it. It sets everything off because your bucket is already almost full and it gets tipped over by everything else. Mold is also a factor. Candida overgrowth can be a factor, and also hidden H. pylori infections. So Helicobacter pylori, which infects the stomach. It does not cause histamine intolerance in every single person, but it does decrease stomach acid, allowing for you to swallow all the organisms that you come in contact with in air, food, water, etc. But it also can destabilize mast cells. So some clients even have tested negative on stool testing. They've had breath tests that are negative. And yet there's something about their clinical case, maybe looking at certain nutrient levels that commonly end up low, variety of factors. And I'm like, yeah, I think you might actually want to try to see if dealing with H. pylori would be helpful. And it turns out that it was. Was it the thing? No. A lot of times there's a combo. I hope that you guys are getting that sometimes there is a combo effect of different factors that are driving the problem. So that's what you want to start looking at. So is there this chicken and the egg question that I got? Can histamine intolerance cause candida overgrowth? No, it's not going to cause candida overgrowth. You have to ask yourself how you ended up with candida in the first place. And then candida itself can cause that destabilization to happen. So did candida overgrowth happen because you were exposed to tons of antibiotics? Maybe you were, in all honesty, I think we discount how much alcohol plays a role in allowing for fungal overgrowth. So if you are a heavy drinker or were a heavy drinker, and then stop, that doesn't mean that the underlying issues just magically go away. You can also have exposure and this sort of encouragement of this dysbiotic state where candida sort of takes over internally because you live in a very, very moldy environment. And that environment could be current, it could be in the past. I actually work with a physician who we met last week, and I had suspected a variety of things going on. And I said, I think you have a mold problem. And he was like, no, 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 we've checked. Our house is fine. I was like, something's not right. Like certain things you're saying don't seem right. So let's do some mycotoxin testing. He had 3 different mycotoxins come back as high. And as we began to talk through, and he had stool testing that showed that he had fungal overgrowth. And as we talked through his where he goes and where he spends time at, he acknowledged that the drop ceiling in his office tends to collapse about every 2 months because it becomes so saturated with water that it can no longer stay up. And the people that manage the building just come, they clean away the old tiles that are all broken, they replace what is no longer up top, they leave the other tiles that are soaked but are still in one piece, and they let this happen again over and over and over again. And he would develop really bad migraines every Monday as soon as he got into the office. And he also told me, as he thought about it, that his staff often complains of migraines and not feeling well as well. And so he's now going to have to go through the process of getting his office tested and dealing with management there because he has this very clear exposure. And it's not in his home, it's in his place of work. Many institutional places like office buildings, hospitals, dormitories, libraries, nursing homes, etc., tend to have mold. So it's worthwhile to consider that this is not just one factor. It's really important to understand your case, to think about it from start to finish, even several years before the issues began, because it could be a previous exposure that caused the problem. But by no means does histamine intolerance cause candida overgrowth. It's not a chicken and the egg. Candida intolerance can cause histamine intolerance. But there's obviously other factors that cause the candida overgrowth in the first place. So I hope that's a helpful clarification. I am, like I said, going to be doing a whole one of these Ask Me Anythings on candida overgrowth on Wednesday, January 10th. At 3:30 p.m. Eastern time. So if you have more questions on fungal issues like this, you'll be able to submit those questions through the Q&A box that I have for my community members and newsletter readers. So let's talk a little bit about, should you only eat low to medium oxalate foods if you have problems with oxalates? So oxalates are different from histamine. Oxalates, so I know that there is a whole lot of people, and this goes back to the GI tract, by the way. There's a whole lot of people that will tell you that oxalates are really bad for you. And yes, there are some people that are extremely sensitive and have issues to them, but I actually think that most of the people that have bought into this concept of avoiding oxalates at all costs fail to acknowledge the one reality that we have gut bacteria that break down oxalates. So if you do have an issue with oxalates, if you have an issue with kidney stones, for example, you should consider a fungal piece to your picture, because candida can increase oxalates in the urinary tract. Again, does it mean that you have candida living in the GI or in the urinary tract? No, not necessarily, but the gut is really connected to a lot of different areas, and the urinary tract is an excretion pathway. Obviously, there's excretion pathways through the skin. There's excretion pathways through the GI tract via stool. So just keep that in mind. But I don't have, and I've never needed to put a client who had histamine intolerance or histamine overload on a low to medium oxalate. Like that's like not literally not anything that I would concern myself with, because the diet in and of itself, as I said, is a band-aid. I don't particularly love elimination diets, to be entirely honest with you. And I talked about them on the eczema Ask Me Anything from Sunday, which you can find on my channel. But part of the reason why is it can create not only food fear, but we also create nutrient deficiencies that make it more difficult for us to process other things and do, bodily things that need to happen. Cellular function starts to slow down. We take for granted that our body does what it does, that our cells do what they do, but they need these nutrition tools to be able to operate optimally. So yes, it's extremely important that we don't lose sight of that. The more food you take out, the more you have to supplement those nutrients. And for some people, that can become extremely expensive. Also, if you take foods out unnecessarily, especially if they are like a top 9 allergen, you run the risk, if you leave them out for approximately a year or longer, of developing IgE reactions that lead toward anaphylaxis and require an EpiPen. So you have to be really careful. There's consequences to these elimination diets that are not disclosed to patients when they are, told by their functional doctor, oh, take these out. You just stay off of this food, you'll be fine. There can be really negative consequences that impact your physical health, your mental health, and how your immune system reacts. And so we want to be very cautious. So a low histamine diet is used as a band-aid to help reduce that histamine load, but it does not mean that you should be on it for life unless it is absolutely necessary. So just please be cautious with that. So yes, to the question about how do hormones in perimenopause and menopause trigger or affect histamine intolerance, I'll just say this. I don't know that it's so much about, yes, hormonal shifts can impact things, but my concern with that is the increase of estrogen period that's allowed to be circulating in the system, because estrogen makes the receptors on cells more sensitive to histamine. So you might say, well, we start losing estrogen as we get to perimenopause and we get to menopause. But that doesn't mean that your estrogen level is guaranteed to tank. And also, what's considered high estrogen has to do with its relationship to how much progesterone is present. So if we have a higher level of estrogen to progesterone, regardless of where we are, that would still be estrogen dominant. So an estrogen dominant state can be due to what happens in the GI tract that impairs or blocks your body's ability to excrete deactivated estrogen. So my quick little diagram that I'll describe to you guys that I share on Instagram and I've talked about on the podcast before is that your liver turns estrogen off. It helps maintain the appropriate level of estrogen that should be in the body. And yes, this also impacts men, by the way. So the estrogen gets turned off in the liver. It gets sent through the bile to your gallbladder, where it hangs out until you eat something. And if you don't have a gallbladder, then it just constantly drips into the GI tract. So either way, it still applies. We just are like jumping over a step here if you don't have a gallbladder. Either way, the bile ends up in the GI tract and it's supposed to float down and you're supposed to poop out the deactivated estrogen. That's how we get it out. It goes through phase 3 detox, which is essentially the elimination pathway. The problem is that when you have too many gram-negative bacteria, a lot of times this could look like E. coli. We do have commensal strains of E. coli, but if you have an overgrowth of that, and they have an enzyme called beta-glucuronidase, if there's a lot of beta-glucuronidase present in the GI tract as a result of excess levels of gram-negative bacteria, that turns the estrogen, when it encounters the enzyme, back on. The type of estrogen that it gets turned back onto is not the like healthy version of estrogen. It's a free radical version of estrogen. And I had Dr. Carrie Jones on the Healthy Skin Show to talk about this like 2-3 years ago. And so because it's turned back on, you cannot excrete it out. It gets reabsorbed into your circulation. So you can't get rid of your estrogen, and the estrogen type that you have is a free radical form that can do damage in the system. So that is the problem, is that you have these increasing levels of estrogen that you can't get rid of because the GI tract is such a mess. So I just like, I really feel for, I'm so sorry, Elizabeth. I just read, you said I can't eat more than 3 foods. I'm so sorry. If that's, I hope that you're working with a physician or somebody who can help you with this, because you really want to understand what's going on. That's clearly, I think, you know, from that frowny face, that it's not sustainable at all. You know, and it's not good. It's not good for your frame of mind. I had one client that she didn't know what MCAS was. And so she used to have issues where she would break out in hives when she would get hot. And so she lived in Florida. So every time she went out to walk her dog, and it's hot and humid in Florida, she would break out in welts. She also was on such a limited diet that she hated eating. And I'll never forget, and she's not the only person to tell me this, but she had said that she wished that she never had to eat again because of how much she hated eating and interacting with food, because she was on a low histamine diet for so long. She was working with, unfortunately, a health coach. That, like, I really think, like, in this instance, at the bare minimum, when you're dealing with histamine issues, a health coach is not the appropriate scope of practice, because they don't have the tools and the guidance and the knowledge to be able to help somebody. And so eventually, when we really figured out that it was a significant, she had a huge mold problem, that was when I transferred her case to a physician, because I was like, okay, you need somebody who's mold literate, and she really needed mast cell stabilizing medications to help her. So it is a big deal. And you know, it is what it is. And Diana, in terms of your comment about I had blasto, just keep in mind that blasto is not the only problem, and blasto is really hard to get rid of. It is not uncommon to get a clear test. So stool testing in and of itself is not perfect. It oftentimes can fail to pick up parasites, both protozoa and worms, especially worms, but protozoa. Blasto is a protozoal organism, so it's a single cell parasite. That it is real stubborn. So you might not just have blasto, you could have something else lingering or lurking. That's why I was saying a lot of times it's not just one thing. You can't go, oh, I dealt with that, but I still have the problem. It could be a compounding factor. Do you know whether you have other bacteria in the GI tract that is also producing histamine? Do you have potentially a hidden worm infection or helminth infection lingering under the surface? Is it possible you have H. pylori? Is it possible there's a mycotoxin piece to this, or candida overgrowth? So a lot of times we want to think about what's that one thing, but it's not the one thing. This is a multifaceted problem. And I encourage you, as frustrating as that might be to hear, I encourage you to consider that, because I do want to see each and every one of you get better. I really do cheer on my clients and our community, because I want to see people get better. But I feel like a lot of times we get stuck because we're buying into this idea that if you just do this one thing, everything will get better. And that's not the case. And so it implores us to look more globally and say, what exactly is going on? One person asked, how does exercise, any form, from walking to HIIT to yoga, impact histamine intolerance? That's really personal and depends how easily destabilized your mast cells are. My client I just shared, she would just go walking outside to walk her dog. She wasn't doing a brisk walk, and she couldn't handle the heat outside. I've had some clients, so you could test this out and see. I would be really careful careful with exercise. If you get hot and you know for sure it triggers a flare up, then you're probably going to want to consider doing lower impact things. If it has to do with pressure, that might be a different story. This is, again, it's really dependent on what's going on for you. So one thing that may be helpful is taking a binder right before you start working out. So something like activated charcoal. You could also do something like GI Detox, which comes from the company that makes Biocidin. Sometimes those can be helpful to at least bind things up, and also potentially, if you tolerate it, not everybody does, but some liposomal glutathione. So maybe if you're going to an exercise class or the gym, you take a pump or two of the liposomal glutathione, hold it for 30 to 60 seconds in your mouth, swallow, take your capsule of, whether it's the activated charcoal, bentonite clay, the GI Detox, whatever, and then go to the gym. Just be aware that anything, because you're using a heavy duty binder, that you've taken like medication or supplements or food anywhere from like the last hour to the other like hour and a half in front of that, right? So we've got this window of time where that binder will bind everything. So you never want to take those types of binders around medications unless absolutely necessary. But that may be a help for some. I had one client who could tolerate going to Orange Theory of all things, as long as she did that. I've had other clients where they couldn't stand, and again, she lived in a moldy environment, and I kept saying, hey, this isn't going to help if you're in a moldy environment, and she had an allergy on top of the mold exposure to mold. But it sometimes helps people, it sometimes doesn't, but it is a potential option to try. So just as a couple of quick, and if anybody has any other quick questions, you can throw them into the chat. In terms of, so from a diet perspective, in the Skin Rash Rebuild program, for anybody who's interested, we have a whole diet guide and a chart that tells you what the different levels of histamine foods are. So we try to keep people away from this super most restrictive version of a low histamine diet, because sometimes we can tolerate some moderate things. I like to keep people on as broad of a diet as possible. But if you're looking for a good book that is a decent place to start, you could try Dr. Becky Campbell's histamine. She's a histamine like cookbook. It might not even be a cookbook, but it has recipes in it. But her name is Dr. Becky Campbell. And that's one of the better resources that I've shared with clients. So you could definitely check that out. One person asked, I'm suffering from Granuloma Annulare. Is it related to a histamine issue? I know I have problems with histamines as I react to certain foods, especially alcohol. It's better than it used to be since starting Dupixent. I've done light therapy, liver detox, quit caffeine, reduced sugar consumption, stopped anything with fragrance, tried to decrease my stress, all to no avail. I was on prednisone for 14 months, finally weaning myself off. I'm at a loss for what to do next to try for my Granuloma Annulare. So I have bad news for you. I don't have any answers for you on that. That's not a histamine issue, unfortunately. It's a separate problem. I've had clients who've had Granuloma Annulare in addition to other conditions like eczema, psoriasis, and we are able to help everything else but that. Now, does that mean that you're doomed? I never want to say no, because, a problem's only a problem because we don't have a solution yet. I haven't stopped looking, but unfortunately at this point in time, I don't have any concrete answers as to how to help you with that, because a lot of things that we've tried have never made any difference with it, unfortunately. That being said, it's not a histamine problem. So I think you probably are looking at two separate issues. It doesn't mean that dealing with some of the others won't help the GA, but I just want to be very honest and frank with you about that in terms of my experience. I also got somebody else submitted a few other questions. Do histamine-related skin issues, hives and dermatographia specifically indicate a food intolerance or leaky gut or a food sensitivity? No. It's possible that you could have, like I said, a potential lack of DAO enzyme, but no. So leaky gut is not a root cause. I don't know how else to say that. I feel like I need to have like a sign that I put on my website that's like, leaky gut's not a root cause. Stop thinking it's a root cause. So all of you who are here who are probably dealing with this have leaky gut. You don't need to pay a gazillion dollars and do all this fancy testing to figure that out. You likely have leaky gut. Leaky gut happens when the barrier of your gut, the cells are supposed to be butted up nice and tight, so what's in the gut stays in the gut, and it doesn't interact with the immune system on the other side. But because of certain factors, those cells, the cell junctions, become less tight, and things start to sneak through. Now, things that cause gut dysfunction include, yes, gluten exposure, but not everybody's gluten sensitive. Like my husband can eat gluten, he has no problem. I'm not. I lost my tolerance to that a long time ago, but gluten exposure can increase, and we know it can increase gut permeability. And we know that from the work of Dr. Alessio Fasano when they've looked at gut permeability matters in terms of people with and without celiac disease. So that's one. NSAID exposure, so non-steroidal anti-inflammatory medications like aspirin, ibuprofen, naproxen, etc., is another factor. Gut dysfunction, so where we're not breaking food down appropriately, like i.e. when we don't have enough stomach acid, and that could be due to that H. pylori organism I talked about earlier. That causes, there's no backup system in your GI tract. And so if you don't have enough stomach acid, it's like car accidents the rest of the way down. So that can be a factor. Then we have gut microbiome imbalances. Those organisms cause a massive amount of inflammation, drawing in triggering the release of cytokines to try and help draw in immune cells to deal with them. That can cause that. LPS, or lipopolysaccharides, which are produced by gram-negative bacteria that we talked about that also have that beta-glucuronidase enzyme. So we've got a lot of different factors here that can increase leaky gut that, like I said, it's not a root cause. It's like just describing what the landscape looks like, but it's not the reason it got there, right? So we want to get clear on that. So histamine issues are not about whether or not you have leaky gut. You likely have that. Move on. But food sensitivities, if you are reactive to foods legitimately, are usually, again, the result of gut dysfunction and possibly combined with gut microbiome imbalances. So why do my symptoms lessen by eliminating foods if eliminating foods doesn't cure leaky gut? Because you're probably eliminating foods that have higher histamine content and lowering, right? You're improving your cup essentially because you're not overwhelming it. You're not overloading it. That's why. And it may also have to do as well with the fact that when we have gut dysfunction, then nutrients and food and such interact inappropriately with our gut microbiome, however it may be. And that includes not just in the colon, but also up in the small intestine. And so sometimes what we perceive as a reaction to food is actually this inappropriate interaction that causes us to feel not well. So just food for thought on that piece of things. I talk a bunch about that in my most recent podcast episode where I talked about food sensitivity testing. I'll throw that into the chat as well for any of you who are interested in reading more about that. So Grover's, I don't know if Lori, is Grover's disease is considered a histamine intolerance issue. I don't believe it is. I don't have any experience working with Grover's disease. I do have a podcast on that, actually, just one. It's not obviously, unfortunately, a common skin issue. I'll throw that into the chat as well if you haven't listened to it yet. But there is, there may be things, again, it's part of the problem is, like, I haven't worked with every skin condition, especially some of the more uncommon ones. And it's not to say I'm not willing to give it a go, but it also has to be up to that person. That is a chicken and the egg situation where, unfortunately, unless it's something that you're willing to dig into to see what's there, it's really hard for me and other practitioners to be able to know is that even a factor? So I do my best. And unfortunately, there's not a ton of research going on looking at like the gut microbiome and Grover's disease and whatnot, which is so, I know it stinks so much, but I'm doing my best. I'm trying, always trying. I really, really am. And it's something that, I keep holding space for, hoping that I'll be able to come up with answers for people. And then, do gluten, dairy, and corn cause an inflammatory response? If so, why? Why not seemingly in everyone? As I said, gluten is the only food protein that has been shown in research to increase gut permeability. Um, I do not believe, I am not of the camp that every single person is sensitive to gluten, dairy, and eggs or corn or whatever. I also am not of the mindset, and I'm looking at this from clinical perspective, that every person is sensitive to these and they're the cause of everything. I actually think that functional medicine, and I know I work in this space of functional integrative medicine, but I think functional medicine has done a grave disservice, especially from many of the books that have come out over the last 10 years. And I've interviewed many of those authors, but I do think in hindsight, those books have done a grave disservice by turning people against food and making them believe that the food was the problem the entire time, rather than helping them better understand other underlying causes. It's hard to write a whole book about why your gut microbiome is a big piece of the problem, why gut function is a big piece of the problem, because you need additional testing. You need a lot of extra schooling to be able to decipher a lot of this information, which cannot, unfortunately, be imparted in a book. It's not something you're going to be able to learn in one book. So, I've spent years learning this, and I'm not going to claim to be the smartest person in the room. I'm constantly learning things, which I'm so grateful and glad that I'm in this opportunity to be able to do that and pass on this information to clients and to the community here. But those are not inherently trigger foods. They're not evil foods. They're not bad foods. I think we need to get away from calling things good versus bad. I mean, look, nobody's going to argue hydrogenated oils are probably really bad for you. I think we can all agree on that. But when we start to get into these larger food groups of foods that exist in nature, that's where we start to have problems. I don't believe that there is inherently specific trigger foods for most skin conditions that we absolutely 100% need to avoid. There are some conditions like hidradenitis suppurativa where removing, in some individuals who show reactivity to the anti-Saccharomyces cerevisiae antibody, it's a blood test, those individuals tend to do better by removing yeast from their diet. But one could also argue that marker is triggered or elevated by the presence of yeast, by your body becoming aware of it in your body. Your immune cells are seeing it in your body. And so could that, and I don't have an answer for you, I don't want to answer it and just assume, lead you all to believe, and whoever watches it, that yes, you absolutely have a fungal overgrowth problem that underlies HS. But are we looking in that direction? I don't think so. I mean, most of the conventional world has moved on to find biologic medications that can just try to really manage or halt the disease process, but leaves the underlying problems in place that can drive inflammation still and show up in other ways. So it is, we all have to decide what we're going to do about our own health. But I would just caution you from this idea of blaming food, especially since this is literally 3 questions of all about food being the problem. And my hope would be that if you're seeing this, whether you're here or you're watching the playback of this, that maybe you take a step back, you hit the pause button, this whole idea that food is the cause or the culprit here. I think you have a bigger issue. And that sometimes is scary because we want it to be this one thing. We want to be something, I just take it out of my diet and magically I'm better. But that does not fix everything. It doesn't stop it. So to answer your last question, and I think this is a great place to leave things off on, and I'll also, actually, before I answer your last question, I just want to share a couple of things. I talked about those binders, but also I have a few things that I use with clients. So the first one that I just wanted to share with you guys is immunoglobulins. So I use like Mega IgG from Microbiome Labs, which I'll put a link to. We have it in quellshop.com. It's an immunoglobulin product that can be used to really help reduce reactivity. And in some instances, when we get clients privately, we put them on therapeutic doses, and they're actually able to start really reintroducing foods. They're way less reactive because the immunoglobulins are extremely helpful in trying to drive down that IgE response that's happening in the system. And it also helps bind to different things in the GI tract that are contributing to that histamine overload scenario. So there's that. I also love vitamin C and bioflavonoids, things like rutin, etc. And so we do have this really great vitamin C powder. I actually take it every day called C Plus Boost. And it's really tasty, but also the vitamin C is helpful again in solving some of these root cause issues. So I would encourage you to consider something like that. And then the last thing is also to liver support's really important. As I said, when we go on our different elimination diets, we tend to start depleting certain things, and we don't make all the nutrients our body needs to thrive. We are a nutrient consumption factory, not a nutrient production factory. Yes, we make some nutrients, but we don't make enough to thrive without eating, right? We will die if we do not consume food and nutrients. And so I just want you to consider that phase 2 liver detox is highly dependent on nutrient stores, specifically certain amino acids and whatnot. And so we have a great, this is my favorite, the P2 detox balance that we have at Quell. And it's a very unique product. It's not a liver detox product that detoxifies your liver. It actually is the nutrients that are required for phase 2 detox to actually help them move appropriately. So we don't have this backlog between phase 1 and phase 2. I love talking about that kind of stuff. It's really exciting to me. But anyway, those can all be found over at quellshop.com for anybody who's interested. And to answer the last question is, can somebody be cured of skin hives and dermatographia? And if so, how? First of all, I'm not going to say the C word because I'm not allowed to use that. So pretty much we're not allowed to use cure, treat, and heal. But I have had clients who no longer have problems. So the woman that I was telling you about, the story in the beginning of the woman who couldn't wear tight pants, yoga pants, all this stuff would press into her and she'd end up with severe dermatographia and whatnot. She was actually able to reintroduce high histamine foods. She went to Mexico for her birthday. She actually sent me this really nice, lovely message on Instagram, which I share on my website. And she can wear yoga pants now. She doesn't have any issues. We've had plenty of clients who've had massive improvements where they're no longer having outbreaks of hives, no longer having outbreaks of dermatographia anymore, can reintroduce foods. So yes, it's possible. Is there a silver bullet here? No. This is a journey, and I'm just being entirely honest because I'm sort of tired of everybody online saying, I have the solution for you in 30 days or less. Like that's not realistic. These are usually, as I said, they're multifaceted, multi-layer issues. It's not just one thing. I wish it was. It would make it so much easier for me to say, just do this one thing. But in order to really deal with this problem, it's number one, you have to identify the root cause issues that are driving up that histamine cup, right? So it's causing it to overflow and causing your system to get just like your mast cells to degranulate, just be so easily irritated that you've lost tolerance. You have to figure out what those are. I do have a guide that can be helpful for some. I'm just trying to see if I actually have that. I do not have that in front of me. I'll see if I can quickly find it for you guys. But my root cause rash finder can be a really great place to start if you're trying to look at your system-wide issues to identify general root causes. So like you could say, okay, do I have a gut piece to this? Do I have an endocrine or thyroid piece to this? Do I have, a gut function piece to this? And then you can start digging into those places with appropriate testing. So you have to know what's going on in order to address it. If you have a mold problem, that's drastically different from if you just have, like, say, some H. pylori and maybe some of the bacteria hanging out that produce histamine, right? That's vastly different things. So we need to know what's going on. We also need to manage and support phase 2 liver detox, because that's where we're looking at the utilization of glutathione and a lot of these other pieces, like methylation is part of phase 2. So that's really important. And then also making sure to look at your nutrient levels, because oftentimes that's ignored. We assume that our nutrients are fine, but they're really not. And those are the tools, right? It's not just for liver detoxification. I'm talking about B vitamins, vitamin D, vitamin A, etc., CoQ10. We're looking at nutrients to help make sure that your mitochondria can thrive, that they can make ATP or energy, that we can do all of these different things. And then from there, coming up with a plan based on what is going on that makes sense to get you out of it. But like I said, I do find, and so it may be worthwhile to try, as long as you don't have an allergy to cows. You don't have alpha-gal syndrome, because that's the only problem with immunoglobulins, because they come from bovine, specifically immunoglobulins come from the serum of cows. And so obviously somebody who has alpha-gal or a beef allergy can't consume them, but they can be really helpful in the meantime to help decrease your activity. And depending on the severity and how slimmed your diet is, maybe talking to your doctor about some mast cell stabilizing medications if it requires that, and the antihistamines aren't sufficient enough. You can certainly try quercetin, you can certainly try nettles. They can be a helpful part of the picture, but I don't think that for a long-term solution, they're definitely not it. You also shouldn't be on quercetin at like a therapeutic dose for probably longer than usually. I try to get people off of it after about a year, because it can start to mess with your blood sugar and your thyroid. Not in everybody, but you do need to monitor that. So just be aware that there's not a one thing that I can tell you to do. It's complex. So I just wanted to share with you guys too, if you're interested in digging deeper into like the full body root cause thing that I've talked about, because there are 16 root causes that I've identified in my practice. I'm actually hosting a webinar on Tuesday, January 9th at 7 p.m. Eastern time. I know I'm like doing a lot of these lives, but I'll put it into the chat. It's rebuildhealthyskin.com. You can register for a seat for that free webinar. It'll probably be about 2 hours long. I do a whole Q&A, and we go through issues that the common stuff that most people try, that all the websites and influencers and people online swear that works, that just does not work. And so I like to talk about how to look at your case from a very different perspective. Part of that conversation was today. But when we go through that whole webinar, you'll see this is a very different process than the way most people look at it, because I'm looking at it using current research that nobody else has really translated into. And it doesn't mean I'm smarter than anybody else. I was just a little more creative. I took the research that drug companies use to get the FDA to pass the medications that they now have clearances for. And I said, well, what happens if the medications work for these particular conditions? And that means that those people have those elevated cytokines. What drives up those cytokines? So why don't we start addressing those? And that was how this whole process began to unfold, which is not how most people look at this. And that's why, the Healthy Skin Show is so popular, why we've had over 600 people go through the Skin Rash Rebuild, and why we have clients all over the world that we see in my clinical practice. So if it's something where you are looking for like more private help, I'll certainly throw that into the chat here. You can go go to healthyskinshow.com and we have a work with me section. You're more than welcome to check that out. We do have, again, clients who work virtually all over the world. But the Rebuild Healthy Skin, that is probably the best next step for you to get more information about the process, right? To really understand it. I've got graphics, all sorts of things. I don't have the capacity. I'm just using a webcam to do this today. So anyway, I hope that this has been helpful. I really appreciate you all hanging in here with me so much. As you may know, tomorrow I'm going to be doing the psoriasis Ask Me Anything. So if that's also an issue for you, you know someone it's an issue for, let them know. That'll be at 2 p.m. Eastern time. This will be available for a replay as well. And like I said, I would love to see you at that upcoming webinar. So go check out rebuildhealthyskin.com. And if there's any other questions, my channel has tons of content. Otherwise, you can find me online at Jennifer Fugo. I'm on Instagram and whatnot, and we can connect there. So I hope you guys have a great rest of your evening. Thank you so much for hanging out, and I will see you soon. Bye, everybody.